Although this lesson is covered in the first facial cupping course, it is very important to go over this information again for health and safety reasons. In this lesson, we'll be looking at the general guidelines for when to perform a cupping treatment or not, what safety protocols to keep in mind, and when to stop doing a treatment. A contraindication means you should not do a cupping treatment if they have a tumor or unrecognizable lumps or bumps. This includes melanoma or other types of cancers. Any infections, including dermatitis and warts, you don't want to risk spreading the infection, possibly passing something on to yourself, or causing any discomfort for your client. Any cuts, severe bruising or inflammation. This can include a black eye or even severe acne. It would be painful for your client, and with open wounds you risk infection. A loss of skin sensation means you could possibly injure your client without them being able to alert you to the pain. Precautions require certain amounts of care and common sense. Some concerns to be aware of include migraines or headaches. It would be very uncomfortable for them to receive the treatment. Depending on the severity of the headache, your client may choose to continue with the treatment or reschedule for another day. You want to ensure you communicate effectively. Sunburn is painful to work on, so here it very much depends on the location of the sunburn. If the body is burnt, but they're comfortable lying down, then you can continue. If the face is burnt, you're going to need to reschedule. With scar tissue, it depends on how new it is. Any major scar tissue should be avoided for at least 6 months to avoid interrupting the healing process. Thereafter, cupping is actually really beneficial for improving the appearance of scars. In the case of diabetes, you want to determine first whether or not they're experiencing any loss of skin sensation. You don't want to risk injuring them. However, cupping can be good for improving nerve function. Sinusitis is incredibly painful and sensitive. Depending on the severity, your client may choose to either continue or reschedule, so remember to keep the communication channels open. Always wait a week to 10 days before working over Botox or dermal fillers. Due to the increased circulation with facial cupping, there may be a reduction in the efficacy of the Botox. Loose, crepey skin can be difficult to work over with cupping. Focus on using the static method of cupping and support the skin firmly. Hypersensitivity may make it too painful to work on your client. You may need to reschedule until it is more comfortable for your client to receive the treatment. Being careful and following proper safety procedures is an important part of facial cupping. You need to ensure that if you're using a plastic cup or glass cup, there are no chips or cracks which could cut or hurt your clients. The skin shouldn't go dry during the treatment, otherwise you risk dragging and stretching the skin unnecessarily. The skin in your ventouse or cup shouldn't exceed a 20% lift to avoid bruising your client or creating a cup kiss, which looks like a love bite or even a bruise. Keep the ventouse or cup moving at all times, aside from the static cupping method. Even then, don't leave the cup suctioning in one place for overly long to avoid leaving a cup kiss. Never overwork an area, as you could bruise or overstimulate the skin. Always break the seal of the cup on the skin before lifting it off to avoid overstretching and possibly bruising. Make sure you're using the right cup size for the area you're working on. A body cup is not suitable for the face. Lift the cup away from the skin instead of pushing down to avoid compressing the underlying tissue. Contractions are concerns which pop up during a treatment. You need to be constantly aware of the treatment you're giving and avoid distraction, which may lead to bruising or telangiectasia or broken capillaries. If you see either of these occurring, it could be because there's too much tissue being lifted into the cup. The cup has been lifted away from the skin without breaking the seal first, the area has been over-treated, you're pushing down with the cup instead of lifting up, or you're leaving the suctioning cup stationary on an area for too long. Another contraction is overstretching skin, usually caused by over-treating an area or dragging looser skin and not reducing pressure. Communication is a vital part of this process. Ask your client open-ended questions about anything you feel or see. If at any stage you're unsure about whether or not to continue, rather be safe than sorry and stop the treatment.